While trying to understand anemia, the first thing you need to do or understand is this, that RBC is nothing but a bag like this, like this. It's a bag actually, you can think like a backpack like bag. And that bag is full of hemoglobin. So RBC is a simple biological cell which has been created in such a way that it's one and single purpose in this world is to carry hemoglobin. So that bag need to be filled with hemoglobin. And that's why you have kicked out the nucleus also from that cell, because we want that as much hemoglobin it carries better. And in that cell we also see some basic enzymes and a cover, like a bag has a membrane, it has also RBC membrane. So RBC, the first big concept that you need to understand, that to understand anemia, the RBC is a bag full of hemoglobin. Once you have understood this, then it becomes very easy to understand the question that why anemia like iron deficiency anemia and thalassemia, which are polar opposite etiologically, they are all both present with microcytic hypochromic anemia. And to understand microcytic hypochromic anemia also, there is only one principle that you need to know, that involves all microcytic hypochromic anemia, whenever it occurs, it occurs due to only one reason. And that reason is that due to some defect in the hemoglobin production. So it's like this, that I want to put some content in the bag. That content is hemoglobin. So when I don't have enough content, I cannot produce enough hemoglobin, the body thinks that there's no sense, it does not make any sense to make a very normal sized bag. So the bag size shrinks because there is not enough content inside the bag. So when the bag size shrinks, the cell becomes small side cell. It is called microcytic RBC. And also, as there is less hemoglobin inside that cell, the cell becomes less red colored, because who gives red color to the RBC, red blood cell? That is hemoglobin. It's a pigment. So when there is less hemoglobin inside the RBC, obviously it would be less red colored, less chromic, less red colored. So that is the basic principle, that all microcytic hypochromic anemia, like iron deficiency anemia or thalassemia, the basic problem is some problem in the hemoglobin production. Let us try to understand this even further. In iron deficiency anemia, what is deficient? Iron. When your iron is deficient, what you cannot produce? Heme. When you cannot produce heme, you cannot produce hemoglobin. So now it's simple, that as you cannot produce hemoglobin, there's not enough hemoglobin which can be put inside the bag. So the bag size would be shrinking, because the body would think that there's not much sense to create a big size cell. It's like this, that you don't come to your workplace, hospital or college, wherever you go, with a 32 size trolley suitcase. Why you don't come? Because there's not enough content to put inside that trolley. You'll be carrying a small backpack. The same things for body also. And also, as the hemoglobin is less in amount, it would become hypochromic. What is the story for thalassemia? Thalassemia is a globin production problem, genetic. So when the globin cannot be produced, hemoglobin cannot be produced. So again, the same outcome, just like iron deficiency anemia, that when the hemoglobin cannot be produced, the body cannot produce hemoglobin contained inside the bag, and obviously the cell size will become smaller and become hypochromic. So this is the basic principle understanding microcytic hypochromic anemia. That microcytic hypochromic anemia, this anemia is always created due to only one reason, and that reason is due to impairment in the production of the hemoglobin. If you look at the other causes of microcytic hypochromic anemia, which is less common, for example sideroblastic anemia, again there is a problem in the heme production resulting in hemoglobin production. Lead poisoning, which is very rare cause, also there is an impairment in the heme production. Anemia of chronic disease. Anemia of chronic disease, the thing is that iron is there in the body, but iron is stored, is unused, cannot be used for the hemoglobin production because it is trapped. So again, iron cannot be used, is not available. So again, the problem would be heme production, and there will be preventing hemoglobin production. So that is the key point in understanding this causes of the microcytic hypochromic anemia, that all of them, they would be caused due to impairment in the hemoglobin production. And one step basic thing I also like to discuss here, that why we call some anemias as under the banner or heading of microcytic hypochromic anemia. Well, when you look at a patient's report, the first thing we'll look at hemoglobin. So hemoglobin low means anemia. But anemia could be due to 1001 reasons. We really don't know that what is the exact cause of this anemia. To further subclassify the anemia morphologically, we check the MCV value, mean corpuscular volume value. So normally, usually an RBC has a size of 80 to 100 femtoliter. In some anemias, the size of RBC would be like a normal sized RBC in a normal healthy person. That is called normocytic anemias, like aplastic anemias, acute blood loss, or most of the hemolytic anemias. Some anemias, the RBC, this is between 80 to 100 femtoliter. Some RBCs, some cases of anemia, the size of the RBC would become more than 100. That is called macrocytic anemias. For example, megaloblastic folate and vitamin B12 deficiency anemia. There are other examples also. But the topic which has been asked is microcytic anemia, because the size of the RBC in this case is less than 80 femtoliter. These are called microcytic. So microcytic anemia, the general principle which I told you, that whatever comes under the microcytic anemia, the main problem would be there is some defect, some impairment in the hemoglobin production. In some cases, like iron deficiency anemia, the hemoglobin production problem would be due to heme production problem. In thalassemia, it would be due to globin production problem. But the net outcome would be impairment in the hemoglobin production, and that would result in small sized RBC and less red colored RBC, which is called microcytic hypochromic anemia. So that is the basic explanation why two different kind of anemias. One is iron deficiency anemia, which etiologically comes under nutritional deficiency. Another is thalassemia, hemoglobinopathy. That is actually hemolytic anemia. They're both present with microcytic hypochromic anemia. Thank you so much.